Dr. John Shepard. I'm director of the Weigel Williamson Center for Visual Rehabilitation at the University of Nebraska Medical Center in Omaha, Nebraska.
Hi, welcome. Can you highlight what was the focus in the Low Vision Symposium here at AAO?
Well, it's been an exciting meeting. We had on Saturday 4 different symposia. The big emphasis on our symposia is to discuss some of the technological developments that are up and coming for low vision adaptive equipment in the future. And also, really, as we get a meeting where we have so many ophthalmologists, is to really help them to see the power of low vision rehabilitation services. Many times as ophthalmologists, we're trained in disease management, so we're coming here and learning a new surgical technique, or we're learning about new medications to treat eye conditions. But oftentimes, with so much emphasis on disease management, we forget about the impact that the disease has on the patient's life. And so this is an area that in low vision circles we really enjoy this meeting, because we can have captive ophthalmologists in an audience and be able to stress to them the importance of asking their patients about the difficulties that they're having functioning in daily activities, and then for those that are having difficulties, the value of vision rehabilitation services. And so we had one symposium where we had great cases with experts in low vision presenting patients that had transformations in their life from the vision rehabilitation services they received. And the hope being that we can broaden the reach of low vision rehabilitation services and raise the awareness for ophthalmologists in referring appropriate patients.
Are there any other steps being taken to engage ophthalmologists in the importance of referring patients for low vision evaluations?
I think the American Academy of Ophthalmology is working with the Vision Rehabilitation Committee of the American Academy of Ophthalmology to get the word out in many forms. For example, on the educational platforms on the web that the American Academy of Ophthalmology has, very open to developing learning plans and having videos that actually the ophthalmologist can go to when they want to learn about vision rehabilitation services and what can be done for those things. Also, the Academy has a tremendous website where you can find a variety of different resources by just putting vision rehabilitation into the search bar. And it will talk about low vision services that are in a particular community, and as well as providers.
In what ways does low vision rehabilitation improve the lives of patients with limited vision?
Well, in regards to being diagnosed with something that causes irreversible vision loss, it's very, very challenging to have a diagnosis like that. And then you have this eye condition where you can't find glasses or medical or surgical treatments that can help, and you're struggling to be able to read, to be able to write, to be able to drive, you name it. And so vision rehabilitation services are great, because in those services you can find resources that can help you to live with this as well as you can. There are tools that can help you to be able to read. There are strategies where you might have to use the vision in a different way to read a little differently, but you can get back to reading again. One of the things about macular degeneration that many individuals think is that it can lead to blindness. And that's one of the greatest things I can reassure my patients, is that macular degeneration affects the center of your vision. It never affects any of the vision outside of the center. And there are strategies to use that remaining vision with adaptive equipment and training activities that can help them to maximize their use of it. It certainly doesn't return the vision back to normal, but it gives them vision that they can use in a way that might impact their activities. It's often depressing to know that you have a condition like this, and it can be harder to do things, and that there isn't some treatment to make it go away. But one of the things about vision rehabilitation services is that they have an effect to where they can better enable you to equip you with means of being able to deal with the functional difficulties that you're having.
Where can patients find low vision rehabilitation services in their area?
Probably the best thing, if you have low vision, is to actually talk to your eye doctor. They may be aware of services in the community. There may be a doctor that provides low vision services, and they may be aware of other resources. That's something that we stress to the ophthalmologist, is to have in large print a list of community resources. Should they not, then going to a website like the American Academy of Ophthalmology's website and entering vision rehabilitation in the search bar, there are areas of that where you can actually find services in your particular community. There are links that can basically direct you to that.
Can you explain the role of an occupational therapist in vision rehabilitation?
Basically, low vision has become a multidisciplinary specialty. Ophthalmologist, optometrist, occupational therapist, certified low vision therapist, orientation and mobility specialists. So occupational therapists are actually near and dear to me because it's part of the model that we have at the Weigel Williamson Center at the University of Nebraska Medical Center. So basically, what I will do is I will see a patient for a low vision evaluation. And as I work with that patient, I understand the functional difficulties that they're having. I come to better understand the quality and quantity of the remaining vision that the patient has. And then I've worked with them with resources and adaptive equipment that can help them to use the remaining vision as well as they can. They've worked with some of those resources for 1 or 2 minutes for me to get an idea if they might work. The role of the occupational therapist is threefold. So I create a vision rehabilitation plan, and then an occupational therapist will implement that plan. And that will include helping people to use the vision they have, and that might be that they have to look to the left or up and to the right compared to what they do eccentric viewing to use the better area of vision that is available. It might be to avoid the blind spot by knowing how to maneuver that to get it out of the way of what you want to see so that you can see it better, and then using different magnifying tools to be able to then see, for example, the print that you want to read. And for some people, they want to sit in a chair and hold a handheld magnifier. There are other people that have arthritis or tremors and they want to have a magnifier that sits on top of the newspaper when they read it. And there are other individuals that want to read for a long period of time, and video magnifier with a much bigger area of view can be very helpful. So the occupational therapist will come alongside of them working with these tools to help them explore what resources may be best. The occupational therapist is also great in evaluating the home environment, the work environment, and so they can help the patient to know what environmental adaptations might be helpful and teach them techniques if they can't make a home visit, and teach them techniques to basically enhance contrast, improve lighting in the home. So occupational therapists have a tremendous role in this process.
That's great. Is there anything you'd like to add in closing?
If somebody is out there that is struggling with low vision, they've been diagnosed with macular degeneration or they have another eye condition, and it just seems as though there isn't anything that can be done to fix the condition, maintain hope, because there are resources that can help you to live with this as well as you can and to maximize your independence, safety, and well-being.
As always, great information. Thank you for your time, Dr. Shepard.